Everybody, welcome to 2025. I hope you all had a great holiday and a happy new year. I am Dr. Garrett Weegriff, a double board certified plastic and reconstructive surgeon here at Pure Plastic Surgery in Miami, Florida. Please go check us out online at pureplasticsurgery.com. There's a bunch of options for before and after photos, a lot of educational content, and also a way to schedule a consultation to get the ball rolling if you're interested in surgery. So today we're going to be going over a list of questions we have if you're thinking about surgery in 2025. So what should I consider before deciding to undergo surgery? First of all, you have to make sure you are mentally and physically prepared for surgery. So what does that mean? You know, it should not be a snap decision. It should be something that you've thought about and researched and, met with a surgeon or two to really come up with the right plan. And just make sure you're mentally prepared for what goes into plastic surgery, including the pre-op, the immediate post-op period, and then that limbo period right after where you're recovering, but your final results haven't kicked in. You just need to be mentally prepared for it all. You also need to be physically prepared for it. You need to try to be at your goal weight, and you just need to be in an overall fit level. And your health needs to be optimized as much as possible to reduce all risk of any surgery that you undergo. Other things you need to consider is who's doing your surgery. If you're going to a board certified plastic surgeon, or if you're going to someone that's really qualified and that does a lot of the procedures that you are trying to get. You shouldn't go to someone that just does a few of whatever the procedure is you're looking into. Me, I do primarily breast and body procedures, and I do them all day long. That is the majority of what I do in my practice, and I am really well versed in doing those surgeries and taking care of the complications that may come with them. The final thing you really want to consider is the clinic, because the doctor is not everything, and a lot of your care and a lot of the interactions you have during this process is going to be with the support staff at the clinic that doctor is working at. So if you've called a few different places and you haven't been really blown away with the service that you've been receiving, you should really think twice about that, because those are the challenges you're going to run into during the recovery period, or God forbid you have some type of problem after surgery. So do your research, pick a good qualified surgeon that does a lot of your surgeries in a clinic with a really helpful supportive staff that's going to help you get through the procedure. And then how do I determine which procedure is best for me? So obviously most of you guys do your own research out there, but there is always nuances to any surgery that we do. You really need to meet with the surgeon, get a consultation to get some idea of what is going to be best for you. They need to go over the pros and cons of each different option that you have to make sure you understand everything and you pick the right option that is right for you. What is the ideal time to start planning for surgery in 2025? If you're interested in surgery in 2025, it is best to start early. So schedules do fill up, availability becomes much tougher at certain times of the year. And like I said, if you want to optimize your health, other things, if you have some comorbidities, we need to look into all those things and make sure they're all cleared. So the earlier you start, the quicker we can address each of those different issues and make sure everything is good to go on your surgery day. What is the role of BMI in planning for surgery? So this is a good question, and this is something that some patients get frustrated by, but we don't arbitrarily just pick BMI numbers as maximum BMIs to do certain procedures because it just makes our life easier or something. It all comes down to your safety, and there's very clear data showing that patients over a certain BMI, their risk of complications after surgery goes up significantly. That's why we have these cutoff values, and we just feel it's not safe to do surgery if you're above some of those BMI thresholds. So again, work on optimizing your health as much as you can so that we have a nice, safe experience when you get your surgery. How can I ensure the best results from my surgery? A lot goes into this. Again, being prepared before surgery, choosing the right surgeon, and then following post-operative instructions and doing all the things we tell you to maximize your results. What we do in the operating room is a big component of what your ultimate result is going to be, but a lot of it does end up depending on you as well, following instructions to make sure you don't mess anything up. Things like lipo 360s and BBLs to make sure you're getting lymphatic massages and wearing your garments and staying off the grafted fat to make sure you get the best result you can. What are the key factors to consider when selecting a surgeon? So, first of all, you should look at their qualifications. They should have actually gone to a plastic surgery residency and fellowship and be board eligible or board certified, meaning that they've completed their residency and they're either in their case collection period or they're done with that and they're board certified completely. This is really the highest level of qualification for a surgeon. Second is you need to have a rapport with whoever is going to be operating on you. Like I said, God forbid you have some type of a complication or an issue, you need to be able to have a conversation with them, you need to be able to talk to them, they need to be able to talk to you, and if you feel like you're not getting any type of that rapport with the person that you're looking into, you should consider that quite a bit, because it makes a big difference if you ever run into an issue. And then you also want to choose the surgeon that is well-versed in whatever you're looking to get, and that they do a lot of those types of procedures. What should I do if my plans change or I need to reschedule my surgery? So here at Pure Plastic Surgery, if your plans change and you need to reschedule surgery, it's not a big deal as long as you let us know early. Most patients book out several months in advance, and there's no fee to change your surgery date as long as you let us know at least 45 days before the scheduled surgery date. If it's after that, there may be some fees associated. So just try and let us know as early as possible so we can make the adjustments that you need to do. So I hope you all are off to a great start in 2025. I don't know if we have any other questions coming out there from the...
Hello, doctor. I'm Yvette, and I wanted to know when I have to wait after a mommy makeover surgery to get a BBL.
At least 6 months. That's the ideal time to wait after a mommy makeover to let everything heal, let your body recover. But at that point, we can go and do the BBL.
What fillers are used for smile lines?
Well, we have multiple different types of fillers, but it's a very nuanced question, but there's ones that are thicker, harder, softer, so there's a lot of different things that go into it depending on what type of smile lines you have. All right. I hope you all have a great day. I will see you back next week for another episode of Thursday Thoughts. Come check us out at pureplasticsurgery.com.